It is so hot out here and muggy. I'll try to I'll try to keep it together, but I might pass out. So I wanted to talk about a clinical experience that I had, and I'm going to purposely leave out a bunch of the details of like the who, where, just because I don't think it's really relevant. And I actually don't want this to turn into like a character hit piece or anything like that because it's not really my intention, and I don't really think it's necessary either. All right, so the long and short of it is that I was in a clinical encounter with a patient. This doctor happened to be a pulmonologist. Just for context, the doctor was a, 50s, 60s something white man. The patient was like a 55-year-old black lady. And she came in, I think she was there for like COPD or asthma or something like that. And, the encounter was going great, nothing weird. It wasn't until the very end of the encounter that the doctor was going to, perform the physical exam. He was going to do his, use a stethoscope to listen to heart and lungs and all that stuff. While he's pulling that off, and he looks at her shirt and he says, "Oh, ACDC." He says, "Did you buy that shirt, or is that one that you were just kind of like given or acquired, some other way?" And she said, "Yeah, actually, I just kind of got this from somewhere. I'm not even sure where. It's just a shirt that I have." And he said, "Oh, okay, yeah, because you don't look like an AC/DC fan." So in my head, I think that gave me pause because it just kind of caught me off guard. I thought to myself, well, sir, what does an AC/DC fan look like? And why does she not look like one? And is it that she's a woman? Is it that she's black? Is it that she's 55? Is it that she has COPD and asthma? I mean, what exactly are we talking about? It stood out to me a little bit because it felt almost as if you were implying like you don't really fit in with the rest of the AC/DC crowd, which is, a little offensive, I think, especially if it was someone who was an AC/DC fan. So I may be projecting a bit, but it seemed like the encounter kind of the mood and the tone in the room did shift a little bit. It was actually made worse by the fact that one of the last things he said was, "You don't look like an AC/DC fan." And then there was no like response or anything like that because he was listening to Heart and Lungs. So everyone was quiet essentially. And that just kind of like hung like on the air. And I think that was like the last thing that was said. And everyone was just kind of, I don't know, internalizing that. It got me thinking about this kind of thing in clinical practice, prevalence of things like this, even defining what this even is, um, right? Because what he said, I don't think, in my opinion, was not like blatantly and overtly racist. I think that you might categorize it as a microaggression. You might categorize it as someone putting their foot in their mouth. You might categorize it as nothing at all. But I still think it's true that it felt a little bit out of place. I don't know if he knew when he said it that it sounded a certain way. He didn't give any indication, but I guess that would maybe inform too kind of how he felt about it. And I think too, in part, what can make this situation so difficult is like my role as the student, right? Because there's a hierarchy, and I'm in a position where I'm essentially the subordinate of this person. Confrontation is hard. And also, it begs the question, is it necessary, right? Is this something that needed me to say something? I ended up not saying anything. And at this point, I had only really worked with that physician for like 3 days. So I didn't know him very well. But up until that point, he had been an incredibly nice guy, super nice guy. I really enjoyed the way that he interacted with his patients. He loved to educate, he loved to teach his patients. He's pulling out all kinds of visual aids and stuff. Like he really went above and beyond in a way that a lot of physicians don't. So I was struggling with that a little bit because on the one hand, I kind of liked him, and it had only been like 3 days. So I didn't really know him that well, but I kind of liked him. On the other hand, he said this thing that made me kind of uncomfortable, and I was like, man, I was a little disappointed. I was just hoping, I really hope that it doesn't turn into more than this. Well, good news is, I finished up my time with him. I ended up spending a total of like 2 weeks. Luckily, in that time, nothing like that, happened again. And in fact, we spent the rest of the 2 weeks with me being incredibly impressed about how, good of a physician he was and how kind he was to his patients. So I think I ended up kind of coming to the conclusion that, he's not a bad guy. And I think that what he he said was maybe just a moment where he put his foot in his mouth a little bit. Maybe he caught it, maybe he was a little embarrassed. I don't know. But after seeing him interact with the rest of his patients, it's hard for me to think that there was malice and that he said it with malicious intent. But does that matter? Is that does that make it better? Probably not. Probably best that we all just be a little bit more careful with what we say. So yeah, going forward, I think in terms of reflection, it's really a bit of being cognizant of maybe your biases or like what you may be saying and how it's interpreted by the patient. It's important to maintain a patient physician relationship, that there's like trust there, right? And I think this type of thing can kind of erode that if the patient felt, offended by it. What are your thoughts? Where do you rank this? Is this overt racism? Is it, microaggression? Is it nothing at all? Would you have reported this guy, or do you think you would have waited, take some time to kind of feel it out? Yeah, I don't know. I think different people might do different things or feel differently about it, but that was how it was for me. Hope you enjoyed the story.